Good afternoon. I'm Mandy Cohen. I'm the Secretary of the Department of Health and Human Services for North Carolina. And this afternoon, I'm joined by Director Mike Sperberry and Brian Tipton and Nicole Fox are our American Sign Language interpreters. And working behind the scenes as our Spanish language interpreters are Jackie and Jasmine Matevier. As always, I'll start with a rundown of our numbers. For North Carolina, as of this morning, there were 9,142 laboratory confirmed cases in 95 counties. We have 473 people who are currently hospitalized, and sadly, there have been 306 deaths. We report these data regularly on our COVID-19 dashboard. That's at ncdhhs.gov/COVID-19. Excuse me. Throughout our response to the pandemic, we have sought to expand the information we share. Today, we launched two new additions. First, in order to standardize reporting, we are posting a new report on our COVID-19 outbreaks in congregate living settings. The report will include names of facilities where there is an outbreak, that's 2 or more cases, as well as a number of positive cases at that facility. The report will be updated twice per week. As this pandemic evolves, we will continue to assess the appropriateness of data reporting to balance transparency, public health, and individual privacy. Second, we now have North Carolina's COVID-19 key metrics to stay ahead of the curve available on our dashboard. As Governor Cooper shared last week, we are looking to make progress on testing, tracing, and trends to guide the state's plan to slowly lift restrictions. There's a new key metrics tab on the dashboard for the combination of the metrics we're following. As a reminder, there are 4 of them. The first is COVID-like syndromic cases. Second, lab confirmed cases. Third, positive tests as a percentage of total tests, and hospitalizations. The dashboard will also share where we are on our testing and tracing capacity, including our supply of personal protective equipment, number of tests per day, and staffing for contact tracing. We also have some progress to share on that front today. I'm pleased to announce the formation of the Carolina Community Tracing Collaborative, a new partnership with Community Care of North Carolina and the North Carolina Area Health Education Centers to expand contact tracing. Our local health departments are North Carolina's expert in this essential detective work. North Carolina has a significant advantage over many other states doing this work because we have that strong public health infrastructure. The new collaborative will hire and train local staff that will support local health departments' contact tracing efforts. This will allow us to meet the goal we shared last week to double the number of contact tracers we have in the state to 500. Contact tracing is the process of supporting patients and notifying contacts of exposure in order to stop the chain of transmission of the virus. This also helps North Carolina understand the spread of disease and more rapidly identify people who may have had COVID. Recruitment for contact tracers will start immediately, today. Anyone interested in applying may visit the Community Care of North Carolina website. Special consideration will be given to those who are unemployed, have community engagement experience, and live in the communities that they will serve. Before I wrap up, I also want to share new information shared by the CDC this weekend. The CDC has expanded the list of symptoms that may be associated with COVID-19. We've been talking for a long time about fever and cough and shortness of breath, but the CDC also added some additional symptoms for you to be aware of. They include chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. These symptoms may appear 2 to 14 days after exposure to the virus. Very important for everyone to know it's not just cough and fever anymore. We want folks to be looking for chills, muscle pain, headache, sore throat, or a new loss of taste or smell. As always, please practice social distancing and wash your hands to prevent the spread of the virus. Thank you for staying home to save lives. And with that, I will turn it over to Director Sprayberry for his update.
Thank you, Madam Secretary. This is day 49 of the State Emergency Operations Center's activation for the COVID-19 response. This morning, I made a trip to the Sandhills Regional Medical Center in Hamlet, North Carolina, which is being prepared and supplied for possible use as a medical support shelter during the COVID-19 pandemic response. If the state's hospitals need additional bed capacity, the Sandhills facility could be activated as a medical shelter to house and treat non-COVID-19 low-acuity patients to free up beds at other hospitals. Sandhills could house about 50 patients if needed. The Office of Emergency Medical Services and the National Guard have been working to clean and equip the facility for possible use. It would be staffed by state medical response system personnel and a North Carolina National Guard medical team, including physicians, physician assistants, nurses, medics, and support staff. Our local partners in Richmond County and Hamlet have also been key to our efforts at Sandhills, and we're very grateful for their support. We may not need it, but if we do, the facility will be ramped up and ready to go. Our mission to find and obtain personal protective equipment continues. Last week, Governor Cooper laid out a requirement for a 30-day supply of PPE to support testing as one of the metrics to meet before we can begin to relax the stay-at-home order. We currently have more than a 100-day supply of gloves, more than a 60-day supply of surgical masks, and more than a 35-day supply of face shields in our warehouses. These numbers change daily. But the gowns and N95 masks remain very hard to get, and we have less than a week's supply of those. We have placed orders for more than 10 million gowns and 27 million N95 masks. Shipments of about 800,000 N95 masks are expected in the next week, along with about 25,000 gowns. We're continuing to work aggressively to source and acquire these items. I also want to take this opportunity today to note that over the past 27 days, our great partners in the North Carolina wing of the Civil Air Patrol have executed the most extensive ground-based mission in their history. During the wing's COVID-19 mission, more than 60 different drivers have put over 40,000 miles on their vehicles, making over 500 deliveries of supplies and equipment to every county in the state. Almost 100 North Carolina Civil Air Patrol members have participated in this mission, putting in around 3,800 volunteer hours. They've also assisted with staffing 2 North Carolina Emergency Management field warehouses. We give a tip of the wing to our Civil Air Patrol teammates as they continue to work behind the scenes to keep North Carolinians safe. We also thank you at home for following the stay-at-home and social distancing guidelines. We ask that you continue to do this. Your actions are flattening the curve and keeping this event manageable for the state's medical system. You can do this. In closing, don't forget to look out for your friends and neighbors and call your loved ones daily. Guarantee they'll appreciate it. With your help, we'll get through this together as one team, one mission, and one family. Thank you, Madam Secretary. I turn it over to you.
Thank you so much, Director Sprayberry. And with that, we will turn it over to your questions. If you can identify yourself and your news outlet when you ask your question. First question. Are you able to get our first question? while we're waiting, why don't I say a bit more about what we've done related to long-term care information? I think folks have known that we've been trying to always strike the balance of transparency and getting good data to folks, protecting public health, and protecting individual privacy. It was really important as we go through this unprecedented pandemic to make sure that we're coming back to revisit policies. That's why today we're moving forward with releasing additional information. We want to make sure that that information is standardized. We saw a patchwork quilt of information released across the state. We hope this will be helpful to folks as we go forward. Let's try again for our question.
Our first question is from Michael Hyland with CBS 17.
Great. Okay. Michael.
Sure, first that you're able to hear me. Okay. Yes.
Michael, we can hear you now. Go ahead.
Okay, great. Thank you. Wanted to follow up on the additional information that came out today regarding the nursing and rehabilitation centers. Will this prompt you all to take any further action regarding any kind of requirements that these facilities must take now that we're all publicly seeing all of this information? And then secondly, do you also plan to release information regarding outbreaks at any food processing facilities, especially now that we're seeing concerns about the supply chain there?
Thanks for the question, Michael. So obviously we have known about the outbreaks. We've been sharing the county and the outbreaks. So we've been putting together guidance to date that have reflected our understanding of the virus spreading to our long-term care facilities. Obviously, we've been very concerned from the beginning about our ability to keep the virus out, or once it is in one of our nursing homes or other congregate living settings. We know that this virus moves quickly. We've put a lot of aggressive work in place, and in fact, I got a number of phone calls over the last week from colleagues around the country asking for our guidance and our toolkit that we can share with others, which is great. We're always happy to be sharing the information that we have put together for our facilities. Obviously, we continue to work with the federal government for additional guidelines. We're going to continue to assess. This is always going to be an evolving situation. There may be new things we learn about infection control or how we should go about things, and we're always going to continue to try to update and incorporate those things into our work going forward. And as far as other data work, we're going to continue to be as transparent as we can to put data up, making sure we're balancing accuracy of that information with getting that information out to the public. So stay tuned. We hope to have more data all the time posted on our website. Next question.
Our next question is from Chandler Morgan with WBTV.
Hi, this is Chandler Morgan from WBTV. So could you expand a little bit more on if North Carolina is prepared or doing anything in terms of outbreaks and food supply and chain interruption when it comes to these for these local farmers and these animal facilities specifically? Could you speak more to that?
Sure. Thanks, Chandler. So as you know, the food processing industry is highly regulated by our Department of Agriculture. They already have a lot of rules around protocols that they put in place. Our team in public health, both at the local level and the state level, has been involved to help them put in place some of the appropriate guidelines to continue to protect their workers as they go through this. As you know, these are essential businesses. They're important to our food chain. We want to make sure that they're able to keep running, and that's why our teams have been working together to make sure that they are following guidelines. I've spoken to many of the leaders of these organizations myself just to make sure they feel supported by our teams, but many are doing all of the guidance and had been because they had learned lessons in other states that they were actually able to bring here to North Carolina. So it's been a collaborative process. We've done a lot of testing on site for these plans, and again, that is a collaboration between our local public health department and some of our federally qualified health centers or other hospital systems, just to make sure that they're supported because these businesses are so important to our food chain and to making sure that we are protecting our workers around the state. Thank you.
Our next question is from Tyler Harden at WCTI TV in New Bern.
Yes, good afternoon, Secretary. This is Tyler Harden with the Lee CTI News Channel 12. I just wanted to ask you about the situation with Vidant Health and the more than 120 incorrect lab results sent to you all. Explain essentially how this happened on your end, and then what officials are doing to prevent this from happening again.
Thanks, Tyler, for that question. Yeah, so on Saturday, Vidant returned, they submit lab results to us electronically. Our team noticed that all of those tests were positive, and rightly picked up the phone and called to confirm, and it was identified that that was not correct. Vidant immediately corrected the information. It's important to note that the patients and the doctors got the right result. So there were no patients who were told that they had a positive result when they was supposed to be negative. So that's a good thing. This was just about reporting data from Vidant to the state. Quickly identified, they fixed that problem, and we've been able to correct it and make sure it doesn't happen. I think this was the process working as it does. Our team is constantly doing quality assurance of the data. When something doesn't quite add up, we pick up the phone and try to make sure that we understand it and that the information is as high quality as we can put out. And so we're always trying to check the accuracy of that as we go forward. Thanks.
Our next question is from Travis Fain with WRAL.
Thank you. Travis Fain here with WRAL. So we don't really know about seasonality with the virus at this point. And as we're kind of heading it through these reopening phases, there's no real guarantee, I don't think, that we won't see another spike in cases. So what is the difference between starting the reopening in a few weeks versus starting it now? If things are trending down due to social distancing, won't they trend back up when we ease those restrictions regardless of when we do it?
Thanks for the question, Travis. I think we were trying to take the guidance that came out of the White House that does recommend in order to restart the phases of reopening, it wants to see trends downward. And so, we are in a different position in North Carolina, as I talked about last week. And we have not seen a spike or a surge, and thus may not see the same kind of decline that maybe other states would see. And that's why we've said we're going to make a modification to those White House guidance. So we're not going to just wait for a decline. We may see a sustained leveling. And now we're just at the beginning of that leveling. I do want to see a sustained period of time where we can say things are level and not continuing to go up. What we don't want to see is cases go up, our surveillance system indicating COVID is going up, so our hospitalizations going rapidly up, right? That we don't want to see. But I think a sustained leveling is reasonable for North Carolina to consider as we think about reopening, but we need to see that sustained period of time. And I think looking at our data this week and next week will allow us to understand, are we in that time period where we're seeing that sustained leveling, or was it just a few days and then we see a trend either up or down? Down would be preferable, and that we would want to see that downward trend for us to move forward. And what I would say is the better position North Carolina is when we reopen, the more likely we are to be successful moving through the phases. If we reopen when we might be in the midst of an upswing, we actually put ourselves at more risk of needing to come all the way back and potentially need to go back to stay at home again. And that's what we're trying to prevent. We want to move through these phases and we want to move through them quickly. And so we're trying to do it in the best data-driven approach that we can, but one that also allows us to move through those phases and not have to revert backwards. On your point around seasonality, I think that is right. We do not know if there's going to be a decline in this virus over the summer. I think we all hope that there will be a decline, and that would be wonderful if we can coincide a decline in the activity of the virus when we are ramping up our opening of things, that will be wonderful, though obviously we can't plan for that. That is our hope, but we have never seen this virus make it through a full annual cycle yet, and so we're going to stay looking at the numbers and focused on the trends that we laid out last week. Thank you.
Our next question is from Michael Falero with WFAE News.
Yes, hi there, Secretary Cohen. Michael Falero with WFAE. Question about the contact tracing effort with the partnership you just announced. What is the timeline to get to the goal of 500? And just to clarify, that's up from the 250 in public staff that the state has already.
Thanks, Michael, for that question. Yes, so we are starting already ahead of where other states are. We have 250 folks who are working on this work throughout our local health departments. We actually did a survey of our local health departments to understand where they needed additional capacity. And the good news is that 70% of them already felt like they were able to handle the workload with their current staff, and that's a good thing. And so what we are looking at is wanting to build up another 250 at least over the course of the month of May. So we want to bring folks on starting today, right? So we're asking for folks to if they are interested in potentially taking on a role as a contact tracer, if they're detail oriented and have work experience with their community, we encourage them to go to the Community Care of North Carolina website and check in, see if there is a ability for them to apply for the job today. So I encourage folks to go look at that. And then over the course of May, we will be hiring up to 250 new folks, and then we will have to see where we are. Obviously, we're going to continue to adjust to the needs of North Carolina. If we see that we are having hot spots in some of our places in the state and we need more workers, we obviously will expand it. That's how we've set up this partnership, for it to be flexible to the needs of our state as we go forward here. Thank you.
Our next question is Kate Martin from Carolina Public Press.
Hi, Secretary Cohen. This is Kate Martin with Carolina Public Press. This might actually be a question for Mike Sprayberry, but I'm wondering what the reality is of obtaining the PPE that we need to actually reopen the state, because that's one of the metrics that I believe you all said we needed, was a 30-day supply. The website says the state has 0 days worth of gowns on hand and about a week's worth of N95 respirators. I guess, what are you hearing about the future availability of these products, and when do you expect the state will actually have 30 days worth of all of the PPE that we need?
Thanks for that question, Kate. I'm going to turn it over to Director Sprayberry, and then I'd be happy to share as well.
Thanks, Kate. And so we are continuing, as I mentioned, to aggressively purchase PPE. And as I said, we have a great shortage of gowns and N95s, although we do expect to have more N95s in this week and some gowns coming in as well. So I think what we're seeing is the supply chain begin to open up a little bit, and we're getting more and more supplies of PPE in throughout really every day. And so we're going to continue buying just like we have been. We've got more resources now. We're working very closely with some more purchasers that we got from our DHHS partners to help us source. And so we're looking at doing some long-term contracts. And also we're seeing more vendors come into play as well. So we think that probably over the next 4 to 6 weeks, we're going to see our ability to source more PPE to be better. So we are headed in the right direction. Thank you.
Great. And Kate, if I could add just a note to say that as we look at whether it's the 4 trend metrics or some of our capabilities, there are things we have to look at together as a package. So it was not one thing in isolation. So it won't be, if we don't have 30-day supply of gowns, does that mean the whole plan is off? And what I would say, that is not accurate. We have to look at it in totality. It is a factor, right? We need gowns in order to do a lot of the work particularly our healthcare workers need to do. And as we think about ramping up testing, so PPE is certainly a major component. But again, we have to look at all of these factors as a total package. And then we have to also take into account there's a lot of inputs that go into the decision, understanding where things are with the business community. The governor is going to continue to take in all of that input. So again, this has to be a broad way of thinking about it, but we wanted to be transparent with you so you knew what we were looking at every day in terms of assessing where we are as a state in terms of our ability to have the PPE we need or not.
Our next question is from Alex Shabad with WCNC-TV.
Hi, Secretary Cohen. It's Alex Shabad, WCNC Charlotte. I just wanted to see what you think the most important steps a nursing home should be taking once they've identified an outbreak, and what resources is the state providing or guidance is the state offering to those nursing homes that have had an outbreak?
Thanks for the question, Alex. So first, we should make sure that all workers in and out are wearing masks at all times. Again, we know that the virus is likely getting into the into a nursing home because a worker may have be an asymptomatic carrier. The other thing is then to test, right? We want to not just test the patients with symptoms, but also test patients that may have come into contact with one of the workers who is now positive. And so where possible, to even test the entire facility. So I think testing and tracing, just like it would be for our community, testing and tracing is really important. So PPE, testing and tracing, and then isolation. There are protocols that we've put in place to make sure that we're separating the folks who are COVID-19 positive from those who aren't, to have staff work just with COVID-19 patients and not go between COVID-19 patients and not. So there are a number of guidelines that we've put out, and we've worked closely with these nursing home associations and others on these guidelines. They're set out in our toolkit that is on our website. And so those are the kinds of things, if we hear of a new outbreak, and again, outbreak is just 2 or more cases, we want to jump on that quickly. We have our local health departments work closely with these nursing homes, help them through the guidance, and make sure that they understand how to do these best practices so that we can control the spread of the virus. Thank you.
Our last question today will be Richard Craver from the Winston-Salem Journal.
Yes, this is Richard Craver with the Winston-Salem Journal. We've had a significant increase over the last few days in Forsyth County in cases, including 25 from Saturday to Sunday. And I was wanting to see, you're looking for a downward trend, but is there a period or is there a point where you would have to basically reset that 14-day period and basically go back to square one, and if you do have a significant number of cases?
Well, hi, Richard. Thanks for that question. And so I think I had a little trouble hearing, but I think what you said is that there's been an increase in number of cases in a particular county. And does that mean they kind of go back and reset on the 14-day period? And so one of the reasons we are trying to look at a statewide is because, things in counties bounce around pretty quickly. They go up a couple cases, maybe 10, 20 cases, and then we see for a couple days maybe they don't have any. And so at the county level, there's so much variation. That's why it's really hard to make any of these decisions about reopening at the county level. And that's why we are looking to these trends at a statewide perspective. That gives us the ability to say, here's the floor we're going to set for the state. It speaks to, though, your question of if we trend the wrong way, would we have to make different decisions? And I think the answer is yes. We need to be driven by the data and what the science is telling us here. I hope that won't be the case. I think we've done an excellent job in North Carolina of staying at home and really slowing the spread of the virus. I know that we can keep those trends going. What we not only want to do is follow the data and open at the right times, but we want to make sure that we're simulating a low amount of viral spread. So we want to simulate the kinds of activities that would keep the virus from spreading. So it's all the things we keep talking about, but that are so important, about the social distancing, about hand washing, using face covering if you can't be 6 feet apart. All those things are going to continue to be really important. Use physical barriers between, a cashier and yourself if that is part of your business. So those are the kinds of guidance that our team is working with the business community, with restaurateurs, with others on right now to say, how do we open not just at the right time, but open in the safest way possible so that we can simulate this low level of viral spread and keep it that way. Because we know this virus is going to be with us. It's going to be with us until we have a vaccine. And so how do we live and work and play with this virus amongst us, but still protect the people of North Carolina? There's a way to do that. If we can follow these good guidance, we can both reopen the state and we can make sure this virus doesn't spread. But it's going to take a lot of work for us to do that together. And that's what's ahead of us over the next number of weeks. All right, with that, thanks for all you're doing to stay home right now to slow the spread of the virus. Remember, the better we can do right now sets us up for a phased reopening in the month of May. So thanks for staying home to save lives, and we'll be back with you again tomorrow. Thank you.